Yes, we're live, and there's more than 300 participants.
Great. Okay. All right. Good afternoon, everybody. Welcome to our Teamsters Local 2010 Town Hall webinar. And thanks to everybody for being with us. We have over 300 participants have logged in, and the numbers are going up. We had over 400 that registered. This is one of a series of webinars that Local 2010 is doing to keep our members informed about our efforts as a union to fight for to protect our safety and our jobs and income during this COVID crisis. I'm Jason Rabinowitz. I'm Secretary-Treasurer Teamsters Local 2010. We're proud to represent 14,000 clerical, administrative, and skilled trades workers throughout the UC and CSU systems. And during this COVID crisis, our members have been standing strong, have been putting their lives and their health on the line as essential workers, keeping the UC and the CSU running. Our work is critical to the university systems and serving the communities and the state. And our union has been working day and night during this crisis to protect our members' safety on the jobs and to protect our jobs, our income, and our livelihood through this crisis. So today we have a big agenda for you, and let me just run through real quick what we're going to be doing. First, we're going to hear from Kevin Riley from the UCLA Labor, Occupational Safety and Health, who is going to be presenting on how to protect ourselves during return to work and how to stay safe on the job. Then I'm going to present on our union's efforts to prevent layoffs, maintain our pay, and protect our income during this crisis. And then Tanya Akel, our field director for Local 2010, will be talking about the action that we're taking together to protect our jobs. And then we have a very special guest, a state assembly member, David Chu, who is the sponsor of our bill, AB 3096, to protect our members at UC from union busting activity. Then we're going to have question and answer session with myself and our Chief Counsel, John Varga. Then we'll hear from President Catherine Cobb, who will wrap it up, and we'll hope to finish within about an hour 10 or so. But we want to make sure to take enough time to hear from everybody. So thanks for being with us. And now I'm going to turn it over to Kevin Riley, who is the Director of Research for UCLA LOSH. Kevin, we're really pleased to have you with us. Thank you, and take it away.
Great, thank you, Jason. Really happy to be here with everyone. I thank you very much for the invitation to join you all today. I'm gonna share my screen here. Let me switch over so you all can see. All right, hopefully those screens or that slide is visible. Yes, okay, thanks very much. So my name is Kevin Riley. I'm with a program at UCLA called the Labor, Occupational Safety and Health Program, or LOSH. Our program is a resource through the university. We have an affiliation with the Public Health School, and we also are affiliated with the UCLA Labor Center. And we serve as a resource for workers throughout Southern California around a whole range of health and safety issues. We do training, we provide technical assistance, and other forms of support. And we've been doing a lot, as you can imagine, as the coronavirus situation has unfolded. So happy to talk a little bit here just about some of the ways we think about the risks for different workers related to coronavirus, and some principles that you all may use to just think about the kind of work that you're doing in your workplaces. So as I think is no surprise to anyone here, the numbers in terms of coronavirus are still very high. There's a bit of a plateau we've seen here in California over the last couple of weeks, but we're still seeing very high case numbers and very high death rates. So this is, even as we're all talking about return to work, this is not an issue that's going to go away anytime soon. Very, very quick reminder to everyone. A lot of us, I think, have been kind of inundated with this information, but how is coronavirus spread? So the virus is thought to spread mainly from person to person. That's been the most focus of contagion between people who are in close contact with one another within about 6 feet, And through airborne droplets that are produced when someone coughs or sneezes, what the Center for Disease Control continues to say about the way this virus spreads is that these droplets in close contact can land in the mouths or noses of people who are nearby, or possibly could be inhaled into the lungs. And that second part, I think, is particularly important to just pay attention to be thinking about. We want to think about, what does this mean in the context of work and the day-to-day kinds of activities that you all are engaged in? What does this mean in terms of the kind of risks we may face? So I want to start off by sharing what I think is kind of a nice model that OSHA has put out to help us think about levels of risk for different workers. And OSHA has kind of given us 4 levels of risk here. So let's look at each of these for 1 second. So what do they define as workers who are at very high or high risk of exposure? Here they say these are jobs where there is exposure, direct contact with known or suspected COVID cases. Okay, so we're talking here really about healthcare, people in healthcare settings, so nurses and doctors, but also environmental service workers, skilled trades folks like yourselves, other folks in healthcare settings where we know we're treating COVID patients or suspected COVID patients. Also in these high-risk categories, OSHA is including things like paramedics and medical transport, medical lab personnel, people who work in mortuaries or morgues. So some of you may be in these categories, and we'll talk in just a second about what that means. But certainly for healthcare settings, there is some high risks that are involved. Medium risk categories, this is what OSHA says. So work that requires frequent or close contact with coworkers or members of the general public. So there's a lot of workers that would fall into this category. You know, things like airport services, nursing homes, transportation. And here again, thinking about the kind of work that you all do day to day, if you're in frequent close contact, say with the general public or with your coworkers, you may be considered sort of at a medium risk. And we need to think about what that means for how to ensure protection for you at your workplace. And then OSHA says that at the low risk, you have workers or workplaces where there's minimal frequent close contact, either with the public or with coworkers. So people that tend to work solo, relatively alone. So from those of us who are occupational health folks, we've been thinking a lot about how do we approach COVID risks and what are the kinds of things we can do in a workplace to reduce those risks. There's a few things I just want to emphasize here. Obviously, the way in which any given workplace is going to approach this is going to be different. All workplaces look different, but there's some very basic principles that we always use when we approach any kinds of hazard, and we're using the same principles to think about COVID as well. For us, there's really 3 fundamental questions that we always ask, and we try and ask them in this order too. The order is important. So the very first question we always ask in terms of how do we control risk is there a way we can redesign the workplace to either reduce or minimize injury or illness? In our technical kind of nerdy terminology, we refer to this as engineering controls. Can we engineer the workplace in a way that helps to prevent injury and illness? So for COVID, this is our first question, and we'd start thinking about ways that workplaces could be reorganized or redesigned in order to make sure that that workers in that workplace are not being exposed. So it's things like changing the way the workspace is structured to maintain social distances, limiting physical access of the general public to the workplace, ventilation systems, barriers. All of those would be considered engineering controls. And the reason why we start with these questions, with these approaches, is that if we can implement controls at this level, we actually can have a really widespread impact. We can prevent a lot of injuries to a lot of different people with some simple engineering designs if we can implement them. So, you know, some of the examples we've seen maybe in our day-to-day lives, maybe you've seen some of these in your workplaces, or things like barriers. Here you have on the left a barrier on a bus to protect that driver. Maybe redesigning the way restaurant work happens, so you're not bringing members of the general public into the restaurant, but you're doing delivery and curbside. You can think about these kinds of measures in your workplace as well. Maybe you, your employers have implemented some of these as a form of protection. Second question we always ask ourselves, what policies and procedures could we put in place to prevent injury and illness? So this is our sort of second line of defense. This is what we would call administrative controls. So are there ways that we can encourage people to be behaving or acting, doing their jobs in certain kinds of ways that are not going to promote the spread of disease? When we talk about coronavirus, this could be things like telework arrangements or rotating shifts to help reduce the number of workers at the workplace at any one time. Maybe policies that are requiring customers or patients to wear face masks, cleaning and disinfecting routines, adjusting production quotas. All of these we might kind of classify in this realm of administrative controls. And here again, you may see some of these kinds of controls in your workplace. So a couple of examples, things you might see out and about. In grocery stores, things like policies about customers remaining 6 feet apart to prevent the spread of disease either between themselves or to workers in that grocery store. Routine cleaning practices. So this is sort of our second line of defense. This is always the way the second question we would ask and the second level of controls we would want to put into place. Now the third question we ask is, what type of personal protective equipment could we use to prevent injury and illness? Now we don't start with this question. This is really important. Personal protective equipment is super important, but there's also a lot of ways PPE could fail. It really requires people to be well trained. It requires people to be fit properly. That equipment may not work as the way it's supposed to work. So personal protective equipment is important, and you all are likely using certain equipment in the work you do, but this should never be the first line of defense, and it should never be the only line of defense. There's a lot of other things that an employer can do before we start to rely on PPE to protect you. So in the context of COVID, we've seen a lot of this personal protective equipment, certainly for healthcare workers that are working close to patients, COVID patients. This is critically important. But we see PPE in other settings as well, maybe some PPE that you've used. And I just want to mention one quick thing for all of you. This is sort of something we've included in a lot of our presentations, just as a quick reminder about some of the differences between the respiratory protection, these masks that we see out and about. And I want to make a very, very quick and important distinction between N95s, surgical masks, and then these cloth masks that are being produced for the general public. So this might be a review for a lot of you, but N95s, these are specially designed face pieces that they're intended to be tight-fitting against the face. They're designed specifically to protect people who wear them from airborne particles. So if they're produced correctly and if they're worn correctly, they will filter out about 95% of small particles that might be in the air, and that would include coronavirus that may be in a work setting. Workers who use these, though, you need to be fit tested. You need to know how to check for the seal to make sure it actually is fitting properly on your face. And really importantly, these are designed to be disposable. There's been a lot of discussion recently about reusing N95s because there's a shortage. Healthcare workers have had a very difficult time getting a hold of these. But really the way they're designed, they are intended to be disposed of. And that's the way, particularly when we get to a point where the shortages, where the supply chains start to open up again, we want to go back to those as being disposable. Surgical masks have a very different function than N95s. So these are not tight fitting. It protects the wearer against droplets or splashes or sprays, but it's not protecting against those airborne particles. These are not designed to filter out the air. These are loose fitting, and they're also designed to be disposable. And then finally, these cloth masks that a lot of folks are wearing, it's important to note that these cloth masks, they're not even providing the same level of protection as a surgical mask. A surgical mask is typically made with a material that's impermeable. It's not going to allow liquids to pass through. A cotton cloth mask can allow some of those liquid droplets to pass through. So what these are good for ultimately is members of the general public, because what it does is it helps the person who wears them, it helps them to slow down the spread if they're sick they have coronavirus, it helps to to slow down their spread of disease to others. But in a work setting for you all, you don't want to be relying on these cloth masks. You are going to be needing, if you need some sort of face protection, you're going to need either surgical masks or N95s, and you want to talk with your employers and your union reps to figure out what the best type of protection will be for you. So these, just as a reminder, these are our questions that we always ask. And the other thing we always emphasize here for workers, for employers, is that in thinking about all of these, there always needs to be opportunity for worker training and for practice. These are new skills, especially right now. A lot of workplaces are changing how they're doing their procedures. Workers need opportunities to practice, to give each other feedback, to evaluate how things are going, and to sort of change as things happen, as things move forward. So I'm hoping that you all have the opportunity to do that with your coworkers and with your union representatives. I guess the last thing I'll just say to wrap this up is that for you all working here on campuses, there's a couple of LOSH standards that I think it's important to know that cover you in the context of coronavirus, and that you and your union reps should just be familiar with. So there's two key ones here I just want to point out. For those of you who are working specifically in healthcare settings, California has what's called the Aerosol Transmissible Diseases Standard, or ATD standard. Under this standard, employers are required to have plans in place to make sure that workers are protected from infectious diseases like coronavirus. So there's a lot of details that go along with that standard. We can provide more of those to you, but I want you to know that there's some protections there, and you want to make sure that if you're in a healthcare facility, if you're in a hospital or a clinic or some other place where patients are being cared for, there are requirements that your employer has to maintain protections. And then for all workplaces here in California, healthcare or non-healthcare, there's a second LOSH standard which would cover coronavirus, and that's the Injury and Illness Prevention Program. So regardless of where you work, your employer has other responsibilities specifically under that standard to be protecting you in the case of COVID. So just a couple resources here. If you go to the LOSH website, there's some guidance documents about the ATD standard. And what you can see here is just a really quick summary. In terms of requirements, your employer has to have a plan in place. There needs to be control measures to make sure that workers aren't exposed to patients or other people who might be coming in who might be sick. There's requirements for things like vaccines, for protecting workers who become sick on the job, and employee training. There should be opportunities here for your employer to be training you both on what their existing plan is, and then also right now, as that plan is changing related to coronavirus, how the employer is taking steps to protect you. Same kind of thing under this Injury and Illness Prevention Program. There's also requirements for planning, for training, for employee involvement. So all of that stuff, I'm not going to get into a lot of the details, but just know that these are standards that are in place, and that you can communicate back with with your employer, with your union reps, to make sure that these standards are being followed at this point. And then the other thing we just always encourage here is that employers, these standards both have really good language about employee involvement. You all actually have opportunities to weigh in on whether you think those plans are effective or not. There are requirements. Your employer is supposed to be reaching out to you and getting you involved to make sure that these plans actually work. So there's some good language there that can really protect you. So I want to be mindful of time. I think I might sort of leave it at that. Jason, I see a note maybe about taking a couple of questions. Do we want to open it up? We can.
Yeah, that would be great. If you have time for questions, we've got several that have come through. Thanks to Kevin for that presentation. And if you have any questions for Kevin, you can type them into the Q&A part on your screen. We have several questions for you, Kevin.
Sure.
I'll go in order here. One is from Lisa Morrow. A concern for us is, in our building, is central air. Sounds like it's a question of whether that's a danger or a risk that needs to be addressed.
Mm-hmm. I mean, obviously, I think that's going to depend on the facility, but generally, I think ventilation, I would say, is generally a positive thing. You want to be encouraging airflow. I think the higher risk are small spaces where there's not a lot of change out of the air, there's not a lot of ventilation. And in those cases, if you have, say, a lot of people in one place, that air can get some stuck there. So I think central air, if you're just talking about kind of a regular building with an air conditioning system, a heating system, I think those are generally good systems to have in place. The other thing is in healthcare settings where patients with COVID are being cared for, those patients actually are required to be treated in very specially designed rooms where the ventilation actually it changes out much more quickly and the ventilation system doesn't feed back into other parts of the building. So in those cases, there's some very special requirements. Some of you may be even doing some of the like engineering work to maintain those systems. But for a regular office place, I think central air is fine generally.
Okay, thank you for that, Kevin. Our next question, can the virus be spread by normal speaking?
There is some evidence that it can be spread by speaking. If someone is infected with the virus, there's always a concern about about any sort of droplets that person is producing. So I mentioned coughs and sneezes, but more and more research is also finding that things like speaking, singing, talking, all of that also produces droplets. And so if you have someone who's infected, they could potentially be spreading the virus through all of those means. We've actually seen some outbreaks in churches and choirs where people have been singing. You've had one person who's sick, they didn't know it, they were singing, they produce all these droplets and end up infecting other members of the choir.
Okay, thank you for that. So here's another question. UC Path, which for Kevin's benefit, that's our payroll center where we have a lot of Teamsters that work in a kind of a large office environment. UC Path has indicated that they want employees to wear handkerchiefs instead of any masks so that the employees in the call center can be audible when answering the telephone. I said office, but I should clarify that it's a call center. So everyone's on the call all day, and in some cases in the past have been clustered together, rather close quarters and cubicles. So that's for background. So the question is that they want the employees to wear handkerchiefs instead of masks so the employees can be audible when answering the phone. Based on OSHA, it states that masks should be well fitted below the chin. This is concerning. It doesn't appear they've done research or that they really do have the employee services department's welfare at heart. Can you comment on those type of masks, Kevin?
Well, I guess what I would say here is that this gets back to why the question of personal protective equipment is sort of lower down on our list. I mean, the first thing I would really be wanting to look at in any of these call centers is there any way at all to promote distance between workers, between the folks that are in these centers? Maybe creating some barriers between call stations so that there's starts to minimize some of the flow of air and droplets between people. You know, the cloth masks or handkerchiefs, I suppose, are okay, but you don't want to just rely on that. Like, I would really be looking at other ways of trying to minimize how many people are in that space, keeping them at distance, and trying to create some barriers between them.
Okay, thank you for that. And this is something that our union has been fighting on in lots of locations, including UC Path, to make sure that there's appropriate distancing, that people can telework instead of working in the office where that's possible, and that other safety measures are followed. So
yeah,
at
the end of the day, I think those will be much more effective if you can get those in place.
Yeah, and so to the person who wrote that question, who's anonymous, and to everybody that's on this meeting, if you have safety issues or concerns like this in your workplace, please call your union rep. If you're not sure who your union rep is, you can go to our website, teamsters2010.org, in order to find out. There's also on there lots of information in our COVID-19 section of the website. So if there's any safety issues, please let the union rep know, or your steward, so that we can take action to protect our safety. So here's another question from Hugo Ayala. Why are some employers asking for 2 COVID tests? I think it's testings within 24 hours of the first one. CDC does not require 2 in order to return back to work.
That is I'm not sure, to be honest. I mean, I don't know if Hugo's referring to, is Hugo referring to people who've been sick and are recovered, or are they looking at, in terms of back to work, we're talking about people coming back, returning into a business space that had been closed?
Yeah, I'm not sure.
What the employer might be wanting to do, because it can take up to 2 weeks. If someone's exposed to coronavirus, it can take up to 2 weeks before they become sick. And so maybe what the employer here is trying to do is to do 2 tests to make sure that, okay, we test you this day, but maybe it just hasn't shown up in your system yet. So we do another, but within 24 hours also doesn't really, that's not a very long period of time. I would want to space those tests out a little bit more, maybe over a few days or a week. So I'm not really sure what that's about.
Okay. Byron Morton, do I need to wash and sanitize my clothes every day?
I think obviously it depends on the kind of work you're doing. If you're in a healthcare setting, it may be not a bad idea to be, removing your clothes at the end of the day and giving them a good cleaning. In this case, you just throw them in the laundry. They don't necessarily need any special sanitizing. But if you're doing work in an office space or call center, it might not be as necessary. But if it makes you, feel better, there's no reason not to. But certainly, like healthcare workers, for example, that are in a healthcare space and caring for patients, they should really be cleaning their clothes on a pretty regular basis. Their work clothes.
Okay, what kind of masks would child care teachers, or should child care teachers wear?
Oh,
we
man.
have, just for your benefit, we have members that are early childhood education teachers. So they're preschool, they're with small children in close contact. And right now, anyways, you get the question.
Yeah, no, I see where you're going with it. I'm struggling because I feel like schools are a whole other realm. And what I can do, if you'd like, is I can go back and ask some of my colleagues who've been looking a little more closely at best practices for school settings and try and get some information there. I'm not sure at this point what the best recommendations are for teachers, but obviously that's what I think OSHA would consider a medium risk environment. You've got teachers that are working around a lot of kids. There's some potential there for spread. So I can make a note and get back to you on that.
Okay, thank you. Next question from Diana Sahar. UC needs to give us all surgical masks. UCI expert, and Diana works at UC Irvine in the law school. UCI expert told us at law school that with 2 people talking, that droplets from talking stay in the air for 14 minutes and can even enter the HVAC system. So I guess the question is whether you agree that you have surgical masks, or what should they be doing?
Here's the thing I would say, CDC and the World Health Organization and other agencies, they have been very reluctant to acknowledge the potential airborne routes, and particularly this issue of like droplets that could suspend in the air and remain viable and actually make other people sick. I think though there is more and more research showing that there are airborne types of transmission that, as she points out, virus that can remain for 14 minutes or whatever the period is. So the guidance that comes out of agencies like CDC or the World Health Organization, or even Cal-OSHA, Cal-OSHA are requirements, but employers can go above and beyond that. They should. These are just baselines. I think in the absence of good information right now about exactly how long this virus lives in the air, how far it can travel, when people are likely to spread it the most or not, in the absence of that information, I would say let's be as precautious as we can. So that may be using face masks in addition to some of those engineering controls and administrative controls we were talking about.
Okay, thank you. And I just want to say to everybody that's participating, we've had some questions regarding job security, what we're doing to fight layoffs, protect our jobs, and so on. And that's our next topic. So we'll be addressing that after we get through some of these questions on the safety issue. Okay, our department has assigned fleet vehicles for staff's use. Is there a need to sanitize vehicles since these are shared by everyone in the office to travel to and from campus?
What I've seen recently is that although there's a possibility that COVID could spread on contaminated surfaces. So in this case, if we're thinking about a fleet vehicle, like maybe the steering wheel or touch points in the car, that's not as much of a concern as some of the more airborne routes. So you can probably not a bad idea to just sort of wipe down surfaces. Maybe if you're getting into the fleet vehicle yourself for the first time, wipe down the steering wheel, anything else you might be touching. But I think probably more importantly is, and then also washing your hands, after you get out of the car. But, more importantly is also just like making sure that the vehicles air out, there's some time between when you're using it and someone else uses it. So really just encouraging the change of the air in the vehicle as well.
Okay, next question, and we'll make this the last question for Kevin. We really appreciate you taking all these questions. They're coming at you a mile a minute, so we appreciate it. Here, this is from Glenn Phillips. UCLA guidelines state that masks are only required if within 6 feet for more than 10 minutes. Does that mean the virus cannot be transmitted for the first 10 minutes of being within 6 feet?
Yeah, right. So this also gets back to some of the uncertainty that we have. I mean, let's put it this way. There's nothing magical about 6 feet, and there's nothing magical about 10 minutes. Maybe the virus, does it travel 9 feet? Does it travel 4 feet? We're not entirely sure. So I don't think these guidelines are coming out of CDC. CDC's been the one saying 6 feet and 10 minutes. They're probably not bad guidelines, but what that means is it's not 100% sure. If you're 7 feet away, there's no guarantee that there's not a possibility of spread there. So this is where, again, I would say, let's be a little more precautious if we can, encourage UCLA to go above and beyond what CDC is saying. Like, be a good employer here. Take the lead on really demonstrating some really good protective measures. Don't just fall back on kind of these minimum standards.
Okay, great. So we want to really thank Kevin Riley for being with us, and to UCLA LOSH Center for all their support for working people and helping our local union. If your question was not answered, you can send us an email to the Teamsters Local 2010. I'll ask Amy to put the email address in the chat. You can also always email us directly through our website, teamsters2010.org. And we urge you to check the website very regularly to see updates on the COVID-19 crisis. And you can also always call your union rep or steward with questions. We're going to be having more of these. We're going to have regular trainings and webinars on worker safety through this crisis. Obviously, as time goes on, there's a million questions that will come up, and it's never been more important to have our union so we can stand together for a safe workplace and to protect our jobs and income. So thanks to Kevin for being with us. We appreciate it.
Thank you, everyone, for having me. It's been great.
You're more than welcome to stay with us as long as you like, or I understand you may have time constraints. So we thank you for your time and your contribution.
Great, thanks.
So everybody, our next topic is something that people have been asking about in the chat, and it's foremost on everyone's mind. And that's what are we doing and what can we do together to protect our jobs and income during this time? And as we all know, this COVID crisis has been with us for several months. And during that time, our 14,000 Teamsters 2010 workers throughout the UC and CSU systems have been performing critical services, keeping the university running, serving the students, serving the patients, serving our communities and our state. We have never been more proud of Teamster members. And, you know, it's no different from how Teamsters have contributed throughout history. The Teamsters Union has a reputation that in times of crisis, we step up, and Teamsters perform service in order to serve the community. You know, we're very proud of our 1.4 million Teamsters across the country who are working, keeping the trucks running, the warehouses, keeping the stores stocked with food, keeping our country going, including 200,000 Teamsters in public services. So we are very proud of the essential work, the critical work that our members are doing through this crisis. And we're also very proud of the work that the Teamsters Union is doing in order to keep workers safe and our jobs protected during this crisis. You know, there's never, it's always a good time to have a union because when we stand together in our union, we have the power that we need to win fairness in the workplace. But when you have a crisis like this, when literally our jobs, our health, our livelihood, our future are on the line, having the power that comes with standing together in our union is really critical. So since this crisis started, our union has stepped up. We have, from the very beginning, working day and night, protecting worker safety, fighting to get the right to telework where that's possible. We won the right for thousands of our members to telework safely from home, winning protecting our jobs through June 30th of this year. We've won from both CSU and UC no layoff commitments, paid administrative leave. And so our members have pretty much had their income protected through this crisis. And that's a big deal when you think about the fact that just in the last couple of months in our country, over 30 million Americans have lost their jobs. In a lot of universities and a lot of public sector entities, the layoffs have already started, pay cuts have already started. We've been able to hold them off in Teamsters 2010, and we're very proud of that. But this fight is going to continue. The COVID-19 crisis is going to be a marathon, not a sprint, because the economic effects of this thing are going to be with us for years to come, most likely. Even if, you know, hopefully Kevin's got so many letters behind his name, he's a smart guy, maybe he'll come up with the cure tomorrow, or maybe somebody will do that. Even if that were the case, and I pray that it is, the economic effects of this are going to be with us for some time. And so our efforts to make sure that workers don't bear the brunt of this crisis are going to have to continue. So what's happened since we won the no layoff commitments through June 30th? The state budget has come down. The governor's May revision came down a few days ago, and they're projecting a shortfall in the budget of about $50 billion with a B. And that's an enormous shortfall. It's about twice the size of the rainy day fund. It's about a third of the overall budget. And so there are cuts to both UC and CSU. First, they took away all the increases that were proposed in the previous budget, which was before COVID, the previous proposed budget. And in the governor's May revision, there's a cut of 10% to CSU's budget and a cut of 10% to UC's budget, with an important caveat that if federal stimulus funds come in, that those funds will go to reduce the cut to UC and CSU, which is a big deal. And more on that in a minute. So, so you may have seen in the news that the governor proposed to the state workers, that's people employed directly by the state of California, they're going to get a pay cut of 10% across the board. So that's the environment that we're in. Now, that doesn't directly affect us at UC and CSU because we're not directly employed by the state. So our goal, our fight, is to protect our pay, to protect where we have contractual pay increases, to protect those increases, and then also to hold off layoffs as much as possible and reductions of income. So we have, our union has put together a plan of action, because this is something that we are going to be fighting on together. Our power comes from the fact that our members stand together. And so our message to the University of California and to CSU is that the workers whose hard work has built the universities into the powerful and wealthy institutions that they are should not bear the brunt of this crisis. The UC and CSU are public institutions that, besides providing educational services to the state and serving the patients in the hospitals and so on, also are engines of jobs and economic prosperity in our state. So UC should be maintaining and CSU should be maintaining good jobs in our communities, which will help to speed our recovery, not cutting pay, not laying off people, which will prolong the economic crisis. We brought that message. I was very proud. Our members spoke to the UC Regents meeting this past week. We spoke to CSU trustees previous to that. We got together with the other unions and we sent a letter to President Napolitano urging that workers' jobs be protected. We sent a letter as a union to CSU stating the same. And we are fighting to win the HEROES Act. You may have seen in the news that the House of Representatives passed the HEROES Act, which has many billions of dollars in stimulus for public employers, public entities. This is very, very important because, you know, they had stimulus for the private sector and they handed out trillions of dollars to private companies, to billionaires, no strings attached. And now there are some politicians who are saying, we don't want to give any money to public entities, to those public service entities that are serving our country. Let them go bankrupt, is literally what Majority Leader Mitch McConnell said. So we have a fight on our hands to win stimulus for public services, including public higher education. And so we're going to have, our union sent a letter to the whole California congressional delegation urging their support for HEROES Act, but also we're going to be asking our members to write to members of Congress, and particularly to the Senate, to urge the passage. And we have a campaign and a plan to get our members involved in taking action to protect our pay and benefits. And so in order to say more about that, I'm going to turn the floor over to Tanya Akel, who is our powerful field director for Teamsters Local 2010. And you know, she does great work, and you see that fist behind her, that's what she's all about, is fighting in action. So we appreciate you, Tanya, and please take it away. And Tanya's going to tell us about our plans to fight for protecting our jobs and income. Tanya.
Thank you, Jason. Hi, everybody. So when we fight, what do? We win. When we fight, we win. So I know you may all be alone. I can't hear you, but I really can. I want everyone to say it. When we fight, we win.
Win. All
right. So, and I know it's a very doom and gloom situation that we get in the news, the budget cuts to the UC, to CSU, to our states, to our cities, they're real. But what I'm here to remind you of, there's political decisions. There are people in power who decide if this is going to be really harmful and who this is going to be really harmful to. There are other ways of addressing the crisis that we're in. Some of those ways that the UC and the CSU can avail themselves of are, they do have savings. They have the ability to take out large loans. They do have the ability to refinance, save money that way. They do have the ability to reallocate savings to the workers, frontline staff, and students. And also on the advocacy and the pressure, we need a lot of assistance from the federal government, who we all pay taxes to. And so we all have to fight together to get those things, and we can. So as a union, we have a research department, we have political department, we have communications. All our resources are moving 24/7 into protecting our jobs and our safety. But the most important part is all of you, are those members, is the field actions that we take part of. And last week, I'm so proud of those at the UC who were at work and came out in front of the hospitals and rallies, held signs. took their lunch breaks to send a message, speak truth to power. I'm so proud of those members who spoke at the Regents meetings, telling their stories and sharing how difficult it would be for their families and themselves and their students if there were cutbacks and layoffs. So there is hope. We don't have to do this austerity way of cutting back to make savings happen. Instead, we can reinvest, reallocate, and move on and get through this crisis. But all of you need to participate in those actions, whatever it is you can do. So ask yourself, have I, as a member of a union, what did I do in the last 2 weeks? Did I wear a sticker to work? Did I sign up to speak to the regents or the board of trustees? Did I carry a sign out in front of my workplace? Did I write to my legislators? Did I call my family in other states who may not be as supportive to ask their federal legislators to please support legislation for public funding for higher education? If my answer is no to all those questions, it's still not too late. This is going to be an ongoing fight. And so I want everyone on their daily agenda to figure out and think about what creative things can you participate in each day. And when we send out a call to action, it's really important that people answer that call to action. So I would love to see in our chat, anyone that took action the last week, please share what you did last week. Please share with all of us and help us stay motivated. Because it's really motivating what I saw in action in the field last week. What we want to do right now, we're going to have more actions. We did deliver our petition to the regents that many of you signed. And now what we're going to be doing is collecting your story on social media. And then we're going to make sure that gets to the legislators. We're going to make sure it gets to the UC regents. We're going to make sure it gets to President Napolitano. So I'm going to share my screen now, but you also, all of you got the same email that I did. So I'm just going to share it just to remind you of how important this is. This is for CSU and UC. We are all essential. So what our next assignment is to take a picture of ourselves, our family, and to write our story about what the impact would be of layoffs and cuts to ourselves, to our family, to the students that we serve, to the patients that we serve. So we're going to collect it. You need to hashtag it when you share it on social media with "We Are All Essential," #no layoffs, @IBT. If that's not your thing, take your picture, tell your story, send it to your rep or send it to our communications team. And that way we'll get it out and we'll post it on social media. This is going to be an ongoing process, but it's very important that we all speak out, that we don't accept austerity, that we don't accept cuts that harm us. And we can do that. There are choices. It's speaking power. It's speaking the truth to power. And that's for all of us to do. We've got to get the federal stimulus. We got to get the UC regents to make the right decisions, and we got to stop those layoffs, and we can do it if you all participate. So please share things that you've done so we can all see, and please commit yourself to doing this next action. Other actions that we'll be doing is we will be setting up virtual meetings with legislators. We will continue to testify at all the trustee and regents meetings. And we will continue to take action for those of you at work at the work site. Thank you so much. I'm so proud to be part of your union.
Okay, thank you, Tanya. We really appreciate it. And Tanya, I think you can press turn off screen share on your screen. Okay. All right. And any moment we're going to be joined by Assemblyman David Chu. And in the meantime, I think what we can do is start taking questions until Mr. Chu joins us. He's supposed to join us between 12:50 and 1 p.m. Okay. So we have a lot of questions about our raises for July 1. So all of our members in the CX bargaining unit at UC, that's Clerical Administrative Unit, have a raise scheduled for July 1. Also our skilled trades members in UCLA and UC San Diego as well. And many people have asked, are we getting those raises? And the answer is yes. The university is contractually required to pay those raises, and we will enforce that requirement. You know, what people have asked about is, will they come to us and say, oh, well, we're going to start laying people off unless we take away the raise or what have you. We have had no such proposal from the university. No such discussions have taken place. So we fully expect that they're going to meet their obligation and pay those increases. Now, we're also in bargaining right now for several of our groups, including CSU, for Unit 6, our skilled trades members throughout the CSU system, and for our skilled trades members at Merced, Irvine, and Santa Barbara. Needless to say, this is an extremely challenging time to be in bargaining. When we entered bargaining, we had plans for to fight for fair raises and increases, and obviously now both the universities are coming back to us and saying either they're hiding from us, and as in the case of Merced. Oh, look, we have Mr. Chu with us. Assemblyman Chu. Can you hear me? You're on mute right now. Amy, do we need to unmute him?
Hello, hello.
Hello. We are so glad to have you with us. Welcome.
Thank you. Thank you for having me.
Oh, well, thanks for being with us. We have over 400 Local 2010 members on the line here, and we've been talking about how the union is fighting to protect our safety and jobs during this crisis. We're very pleased to have Assemblymember David Chu with us. Mr. Chu is a great friend of labor, a great friend of working people, and in particular, a great friend of Teamsters Local 2010. He is the sponsor of our bill, AB 3096, to protect UC workers from union busting activity. We're very pleased to have you with us, Assemblymember Chu, and welcome. Please go ahead.
Great. Thank you so much. Good afternoon, Teamsters. It's great to see you all virtually, and it's also great to see the photos of all of our workers. Sorry, I was running a little bit late. I just just left San Francisco's Chinatown with a whole bunch of healthcare workers who are doing testing and contact tracing. But first, let me just say, I hope everyone is doing as well as possible. I know how devastating this has all been for everyone, just personally and with jobs. I am someone who's married to an essential worker and know how challenging this time is. And hopefully my 4-year-old will not interrupt this call as we're doing it. Trying to balance family, trying to balance our jobs, trying to balance the challenges of jobs that may or may not exist. It's a very scary time. And I also just want to thank the Teamsters, not only for years of friendship and alliance and work together, but the importance of unions at this time cannot be underestimated. Our social safety net is being ripped to shreds by this pandemic. COVID-19 is really exposing with a bright spotlight all of the holes in society and all the ways in which things are stacked against everyday people. And what you guys are doing with your organizing is so crucial during this time period. And we all need to be fighting together. I was asked to say a few words about our bill, AB 3096, around UC labor protections. And let me say, I was so pleased when the Teamsters had reached out to me about partnering on this bill, not just because I enjoy working with my labor allies, but your leadership with the Teamsters and your advocacy team in Sacramento is top notch. And we were happy to do it because we knew that they're well respected and we can go far with the team. When they brought to me the evidence of how the University of California had been communicating to its membership, particularly potential members, I have to admit, I was pretty shocked. There were repeated and very clear violations of existing labor law. Suggestions by UC management around implied pay freezes, suggesting a loss of autonomy and how folks negotiate professional advancement, messages that were clearly designed to chill organizing. And the solution that the Teamsters brought to me is really obvious, which is we've got to make it hard for UC to engage in this type of bad behavior. And for those of you who are UC workers, you know that UC has routinely just violated the law, but because there were no real penalties, you take it up to the labor authorities say to UC, bad UC, and because there are no penalties, it literally has been a slap on the wrist. And so our proposal essentially creates a financial penalty to the University of California for violations of the law because we need a solution that stops UC from violating it. Have been saying, UC doesn't violate the law, then they have nothing to worry about. We have nothing that we need to do besides continuing to organize and making sure that our workers are being well protected, particularly during this time period. So proud to report that 2 weeks ago, we moved the bill out of the major policy committee. We have a hearing in the next couple of weeks with our Assembly Appropriations Committee, and then hopefully it's off to the Assembly floor. But again, you should know that your lobbyists and your advocates are already helping to clear the path, knock on wood, for success for this bill. So hoping that we'll have more good news for you as the year proceeds. It's been a weird legislative year. A lot of bills have been held. Probably 80 to 90% of all the things that we would typically be doing at this time period have fallen by the wayside. But this one, we're moving forward, and fingers crossed. But I just want to end by, again, thanking you guys for what you're doing. The fight that you are moving for on so many fronts is so critical, not just for your workforce and you individually, but for so many workers who need that help. And I look forward to continuing to stand with you.
Well, thank you very much, Assemblymember Chu. It's really great to have a friend like you in the legislature. And on this bill, for those members that are not familiar with it, because our union has been working to organize new workers into the Teamsters, the administrative professionals, the skilled trades workers at UC Davis. And our organizing efforts continue. Actually, our organizing campaigns are moving more quickly than ever because more than ever, workers are seeing the importance of a union during this crisis. So we're really glad that this bill is still moving. I have to say, when this crisis hit, I think we kind of looked at it and said, well, maybe the legislature will have too many other priorities and they won't be looking at it. But it's still moving, and that's because of the commitment of David Chu and his office, and we're really grateful for your friendship and your leadership on this.
All good. Let's keep the fight going, folks.
Absolutely. Well, thank you so much for being with us. We sure appreciate it, and we look forward to having you at future meetings and maybe even in person someday at one of our meetings or conferences.
I would love to. Just hope everyone stays safe, stay healthy, and look forward to seeing you on the other side.
Thank you, sir. We appreciate it.
Of course. Thanks.
Okay. So thanks to the Assembly member for that great presentation. And we're going to continue with our questions about protecting our jobs and income. So I think we were in the middle of talking about the bargaining situation, and where we have been in bargaining with CSU, with UC Merced, Irvine, and Santa Barbara, and we are pressing forward. But needless to say, now the financial picture has changed. And so our main goal is to get the best protection that we can for our income and for our jobs, particularly considering that the state is cutting workers' pay by 10%. We don't want to see any pay cuts in our membership, and we're fighting tooth and nail to protect our members in this crisis. We have a lot of questions about returning to work, and questions about when people will be able to return to work, and those that can't return to work after June 30th because of pre-existing conditions or childcare concerns, what's going to happen with that. John, we have with us John Varga, who's our chief counsel for the Local 2010. And so he's going to be answering some of these questions with us. John, do you want to talk about some of that return to work stuff? And I can also address it as well. You're on mute, John.
Indeed, on two different devices, I think. Good afternoon, everybody. So to the extent that you are unable to return to work even after your work location reopens, if you are eligible still for some of the paid leave, that's the point in time that you're going to want to take it. And the first thing that you're going to want to use, of course, is the administrative leave that the university implemented, the 128 hours. And that should be the first form of leave that you use. It could be used even before using any of your vacation or sick leave. And based on the question that Jason just posed, certainly one would be eligible to use that leave. So for example, the work location is open, but due to the worker's own health condition, which would have to be, of course, certified by a doctor, they are unable to return to work, then you would certainly be eligible to use the 128 hours of paid leave. If for some reason that's not sufficient, if that's not enough leave for you to take, there are two other forms of leave that have been provided by federal acts: the emergency paid sick leave and the expanded family and medical leave. Now, as many of the people on this call probably already know, unfortunately, some of this leave is not available for healthcare providers, and we continue to fight on behalf of all of our members and those who we represent who work at UC hospitals or UC health centers to support the right to use this leave, because as we see it, not every single person falls under the definition of healthcare providers simply by working in the health system. But as the state of affairs currently is, those that are considered healthcare providers can't use all of this leave. But for the majority of people, there's an additional 80 hours that's available of paid sick leave that can be taken as a full block. And that can be used for folks that are still under quarantine or isolation orders. If they're told by a healthcare provider that they need to self-quarantine. So for example, if you're particularly high risk, or you otherwise are not able to return to work due to a health condition, that would qualify. And unfortunately, again, this part wouldn't apply for healthcare workers or emergency responders. But if you still have to care for a child whose school or place of care is closed, or there's another reason to care for a family member, then you could use the 80 hours of sick leave. And then finally, there is an expanded family and medical leave, which provides 10 weeks of paid leave. As an employee, you first have to use 2 weeks of your own leave that can either be unpaid, or if you have banked leave, either sick or vacation, you can use that to cover the 2 weeks. Afterwards, a 10-week expanded family medical leave kicks in. Now, it is paid, but unfortunately, it's only 2/3 of your regular pay. But that would be an additional 10 weeks that could be used under the circumstances of unable to return to work because of having to care for a child who's required to stay home because their school has been closed. Now, each one of these lasts until December 31st. So if you haven't used it yet, it doesn't go away until December 31st. So it's still going to be available to you. So that's the order of leaves that you're going to want to pursue is first the administrative leave, then the sick leave, then the expanded family and medical leave.
Hey, thank you for that, John. And we recognize that this is very complicated. And so if you have questions about your specific situation, please contact your union representative with questions about that. Also, just to add what John has said and to address some of the questions that are coming through on the the chat and the questions and answers. What's going to happen after June 30th when the pay continuation runs out. As John mentioned, the paid administrative leave program lasts through the end of the year, but the pay continuation is through June 30th. And so we had to push the university to give that pay continuation. We had to push the university to do the paid administrative leave. And we will also to follow the Families First and CARES Act, the stimulus bills, which they initially did not commit to follow. They could have asserted an exemption and not follow those bills, but we pushed them to do that. So we've been very successful through this time, and we are now continuing to push UC to continue to keep everybody on paid status after June 30th and through the duration of this crisis. And that's what our fight is about that Tanya talked about. As so far, we have not seen in most places any layoff notices. All of our contracts have layoff protections, which require that they provide notice and follow various other requirements before they can impose layoff. We have the right to meet with them and talk about alternatives to layoff. And so we're going to be pushing, as we have since this crisis started, to protect workers from any layoff or reduction paid during this time. Let's take some more questions.
Well, and Jason, I'll just add that the information that I just shared is also on the Teamsters Local 2010 website, which is a fantastic resource for this information as well as lots of other information.
Okay. Yes, thank you. So we have some more questions about both the pay cut for the state workers. So as I mentioned, the Governor Newsom announced a 10% pay cut for state workers. That does not directly affect UC and CSU employees who are not employed directly by the state. So we plan to fight tooth and nail. There should be no pay cuts to UC and CSU employees. UC and CSU have significant reserves and in literally billions of dollars in reserves for a rainy day. They ought to use those funds before they ever consider any kind of cuts or layoffs. But there's no proposed pay cut on the table. The UC did announce a pay freeze for non-union, non-represented employees. And this helps to underscore the importance of having a union, because when you're non-represented, the employer says, you're getting a pay freeze and you have no say in the matter. They set the rules. And that's why the administrative professionals are working with the Teamsters right now to form a union, because they're tired of being walked on during these crises. But that pay freeze is not something that affects Teamster members, because anything they want to do has to be bargained with us. And where we have a contract that says pay increase, that is in effect, and they have to follow that. Where there's not a contract in effect, because we were in bargaining in some places when this started, they have to bargain with us over these issues. Okay. So if you did not have your, it's 1:13. We're going to take one or two more questions, and then we're going to end this. If your question was not answered, you can send us an email or contact your union rep. You can also look on the website, Teamsters 2010. So the question that comes through, does that mean we can get a pay cut? The only way there could be changes to pay would be if they bargain that with us. There's been no proposal for any pay cut. We would not agree to any pay cut. They would have to bargain that with us first, and we would not agree to it. For our CX members and UCLA and San Diego skilled trades, we have contractual raises coming. Those need to be honored by the employer. For the places where we do not have a contract because we're in bargaining, they would have to bargain with us about any changes. And until then, it's status quo, which means that the pay continues as it is currently. Anything you want to add on that, John? Yeah, you looked like you wanted to say something, so, okay.
No, I was listening intently. That was
Okay, good. All right, well, we want to thank everybody for being with us. Now I'm going to turn it over to our president, Catherine Cobb, who will have a few words to wrap it up. Catherine, take it away. You're on mute, Catherine.
Thank you, Jason. As you know, this is Mental Health Month. Every day we are dealing with a lot of issues that sometimes bring stress, and because of this pandemic, these same issues may seem amplified as we are forced to face them head on due to social distancing. There are a lot of uncertainties, but you are not alone. We all are in this together, and the greatest tool that we have is human connection. I'd like to give you 3 things that might help you during this crisis when you're working remotely from home. Separate work from home. Establish a daily routine. Dedicate a separate area in your home for work, not your bedroom. Take breaks. Take your lunch break. Take a walk. Sit out in your backyard or on your patio, and in work at the same time you normally would, and no overtime. The second is sleep is important. Get into the habit of sleep routine. Go to bed and wake up at the same time. And for adults, it may be 7 hours of sleep. And when you're preparing to go to sleep, your room should be cool and quiet. And you know, some of us drink milk, so maybe drink some warm milk to help you fall asleep. Listen to some music, anything that makes you feel calm and relaxed so that you can get the sleep that you need to wake up fresh in the morning. And there also on YouTube, there is a segment on sleep meditation. And the third one is try something new. Learn a new language. Meditate. There are free, fun classes that you can get online. Do something you haven't done before, maybe baking, painting, or gardening. And I would like to say that, you know, we all have feelings. Accept your feelings, talk to someone, and let them know how you're feeling. Don't be afraid. And I'm saying this, and I guess I can say it any better than this. Men, I say this to you too. If you have to talk to each other, please do. You know, you're not hurting anyone by talking. It's helping one another. And take time to smile. It will make you feel good and everyone around you. Remember to shelter at home and to social distance 6 feet, and please stay safe. Thank you, everyone, for being on this. Jason?
Thank you, Catherine. Thanks for all you do. And thanks to all of our panelists and all of our members. I want to thank all of our Teamster members for your hard work and sacrifice that is serving the state, and for standing together in your union to protect the rights of working people. This crisis is unlike anything we've seen in our lifetimes, and it challenges every aspect of our lives. I am so grateful to have our union and to have us standing together during this time to protect our rights. And with our union, with our 14,000 Teamsters 2010 members, with our 1.4 million Teamster brothers and sisters across the country, we're going to get through this together. And so thanks for all you do. We're going to do more of these. So please, please watch your email, social media, and our website for more information. And thanks to all of you Teamsters. Let's keep standing together. Let's stay safe, and let's stay Teamster strong. Thank you.
Thank you.
And with that, Amy, we can end the meeting. Thanks to everyone.